Joining me now, Will Humble. He's the former director of the Arizona Department of Health Services and now the executive director of the Arizona Public Health Association. Will, good to see you. You and I talked 2 weeks ago, and you described something to me about something called care standards. You said your hospitals were starting to use care standards, which I think in common parlance is some version of triage, determining who gets what treatment. That was 2 weeks ago. Now you've got what this ER doctor describes as diversion, actually turning patients away.
Yeah, well, that's what he was describing. Dr. LoVecchio, who I know, was describing actually crisis standards of care in operation, and that's what it means. He talked about repurposing emergency department rooms because they were unable to send those patients to intensive care beds, and out of necessity because they don't have the staff within their hospital, and then they checked the surge line and were unable to find a similar hospital to treat those patients, and so they're doing the best they can. And the terrible thing here is that there's no end in sight. I mean, the number of cases continues to rise. The policy decisions have not been adjusted to make the situation any better. And further, there are administrative things that could be done, like improving the turnaround time with testing, using CARE Act money, by the way. It's not state funds that are needed. They could do it now. So there's several of these things that could make a real difference. But as you mentioned, it takes some leadership to really turn the tide.
The thing, though, Will, about the human mind is our ability to learn from things and try not to repeat mistakes or not habitually repeat mistakes. But in fact, we've seen exactly what's happening in Arizona happen elsewhere, and we thought we wouldn't have to go through this again. We were hoping, people like me who come from New York were hoping that Arizona and Texas and Florida would not have to go through this. And in fact, they did not have to go through this.
Well, that's right. And we didn't have to go through it either, by the way. I mean, the playbook was written in the northeast part of the country where they had a responsible playbook, really, for how to emerge from a stay-at-home order and preserve the sacrifices made by the folks in your state. And we didn't follow that playbook. We basically, I think what we did is adopt the Swedish model, really, and implement that. And I was on Chris Hayes' show a few days ago, and I said, look, I just hope that the other states out there recognize what not to do. Don't follow the Arizona example, because this is a bad experiment. It's not working out well. And if you come out of a stay-at-home order, for crying out loud, come out of it in a responsible way with performance measures that you can document and get compliance with some of these CDC mitigation measures, and make sure that you've got the kind of testing capacity that will help you with your contact tracing. And on all of these marks, we're on.
In fact, when you look at the three things that they ask for in the mayor's letter to the governor, it is those three things. And when you look at places like Japan or South Korea or Taiwan or New Zealand, these CDC mitigation matters, they're simple. This isn't high science. We're not asking for a treatment or a cure or a vaccine. That'll come later. We're just asking for basic stuff that has been shown to mitigate the spread of this infection.
Right. All these things are layers. The testing capacity leads into contact tracing, which that contact tracing is a layer. Complying with the CDC mitigation measures in retail stores, bars, restaurants, et cetera, that's a mitigation measure. We need to have all the layers in place, which, by the way, are manageable things. We're not talking about another stay-at-home order. We're talking about policy decisions and administrative action that, if taken, can stem the tide, move the needle, and get us to the vaccine so that we don't have to do another stay-at-home order, which has tremendous collateral damage in public health and otherwise.